Hey guys, it's Robert from hairlossdaily.com. Finasteride is going to be the subject of today's video, and the subject of many videos going forward, undoubtedly. I'm going to talk about the number one thing that you should keep in mind if you're about to start a finasteride regimen or if you're strongly considering it. This video is kind of made under the assumption that you're kind of either leaning toward using the drug, I guess. It's mainly for those people, but it's for everybody who's even considering it, I suppose. Or even not considering it. Why not? I'm not trying to discriminate here. The number one thing I think that people should keep in mind is that if they stay positive and keep an open mind when they start using the drug and realize that the risk of side effects is pretty low overall, and they're probably going to be fine. You go on some of these forums and this vocal minority of finasteride users make it seem like everyone's experiencing side effects and the drug's just this extremely dangerous thing. And just based on my many hours researching it, that's just not the case. It's a well-tolerated medication. That's not to say there aren't risks. There certainly are risks. But, you're talking about, we've had 5-10-year studies, and all of them pretty much show that it's well tolerated with few exceptions. And in all the studies, pretty much all the studies, legitimate ones, all the side effects ceased upon discontinuation of the medication. So, it's not like it's just going to break your manhood, so to speak, or, give you the dreaded mental fog and the post-finasteride syndromes. It's very unlikely. And if you stay positive and just kind of expect, that it to work for you like it usually does, and you're probably going to be fine. Now I'll just talk about the nocebo effect, I guess, for a minute here. In recent years, there's definitely been an uptick, it's fair to say, in men who are reporting to experience sexual side effects with finasteride propecia. A lot of people are attributing the rise in side effects to the so-called nocebo effect, which basically, in very rudimentary terms, that means when you expect side effects from a particular medication, those effects are often noticed more frequently, and hence the name nocebo. I remember reading a New York Times article a few years back and writing one of my articles on finasteride. I'll link to that in the description if you're interested. They talked about there was a study that was split into two groups. One was informed of the possibility of sexual side effects, and the other was not. They were using, I believe, a 5 milligram dosage of finasteride, which is the dose for BPH, not hair loss. So 5 times, effectively, the dose that you would normally give a person for hair loss. And in the informed group, the group that was notified in advance about the possibility of these sexual side effects, 44% of the patients had sexual side effects, not very surprising. And in the group that wasn't aware of it, going in, only 15%. Again, this is older men, so they're more likely to have erectile issues, etc., than younger men, although it's super common. I think like 40% of men have some degree of ED by the age of 40, so it's not like it's an uncommon issue. Some men are using finasteride as a scapegoat when they're just kind of developing this on their own, and using that as an excuse, I guess, for their lack of performance, whatever you want to call it. So that's a big reason why I think people are experiencing more side effects here in 2020. And as I said, the number one way you can minimize your risk is to just kind of stay positive. I would certainly advise, getting a thorough checkup ahead of time. And I know some doctors are hesitant these days to prescribe finasteride to people who have a history of mental health problems, depression, anxiety, etc., etc. So I was an English major, etc. I should know that. My biggest regret is not starting finasteride sooner. Of course, that's a common refrain on the hair loss forums here on YouTube. So if you're in that camp or you're just kind of considering it, once you do your research, once you get your checkup, it might be best to just tune out the noise a little bit. You can watch my channel, you can read my blog. Yeah, a little shameless self-promotion there. But overall, maybe it's best to just stay away from all the information once you get started, because it's easy to get that overwhelm, and then you start reading about the side effects. You go down the rabbit hole, and then you're just thinking about them all the time. And sure enough, you develop them, whether it's in your head or not. That's the question, I guess, in those cases. And it's unlikely overall that you're going to develop those side effects based on my research. There's certainly risks involved with this medication. I don't, it's disappointing that there's not a more appealing treatment option that effectively addresses the root cause of hair loss, but we are where we are here in 2020. Finasteride's the best first line of attack that we have. So it's generally well tolerated. Take this all for what it's worth. I'm not advising you to use the drug. I'm not a doctor, as I said. But if you stay positive, you go in expecting to have a normal reaction to the drug, expecting it to stop your hair loss, and expecting everything else to function normally, as is the case for the vast majority of users. 1 to 2% was the side effect rate in the studies. And these are long-term, very long-term studies. I think one was 5 years. They've had 10-year studies. And they've all pretty much found that the drug is well tolerated. So, you go in with that mindset, you're probably going to be fine. I hope this was helpful. I've kind of rambled a little bit here. I'll be talking more about finasteride in my upcoming videos. And I guess I'll catch you next time. I'm Robert, hairlossdaily.com. Stay safe out there.